The cardiovascular system, diseases of the coronary circulation or coronary artery disease. Coronary artery disease occurs when the buildup of plaque in the coronary arteries obstructs the flow of blood and decreases compliance of the vessels. This condition is called atherosclerosis. As the disease progresses and coronary blood vessels become more and more narrow, cells of the myocardium become ischemic, which causes symptoms of angina pectoris in some patients. If untreated, coronary artery disease can lead to MI, or myocardial infarction. Coronary artery disease is progressive and chronic. Risk factors include smoking, family history, hypertension, obesity, diabetes, high alcohol consumption, lack of exercise, stress, and hyperlipidemia. Treatments may include medication, changes to diet and exercise, angioplasty with a balloon catheter, insertion of a stent or coronary artery bypass graft. Angioplasty is a procedure in which the occlusion is mechanically widened with a balloon. A specialized catheter with an expandable tip is inserted into a blood vessel in the arm or leg and then directed to the site of the occlusion. At this point, the balloon is inflated to compress the plaque material and to open the vessel to increase blood flow. Once the balloon is deflated and retracted, a stent consisting of a specialized mesh is typically inserted at the site of occlusion to reinforce the weakened and damaged walls and prevent re-occlusion. Coronary bypass surgery, or coronary artery bypass graft, is a surgical procedure which grafts a replacement vessel obtained from another part of the body to bypass the occluded area. Myocardial infarction. Myocardial infarction is the medical term for a heart attack. An MI normally results from a lack of blood flow to a region of the heart, resulting in death of the cardiac muscle cells. An MI often occurs when a coronary artery is blocked by the buildup of atherosclerotic plaque. It can also occur when a piece of an atherosclerotic plaque breaks off and travels through the coronary arterial system until it lodges in one of the smaller vessels. MIs may be triggered by excessive exercise in which the partially occluded artery is no longer able to pump sufficient quantities of blood, or severe stress, which may induce spasm of the smooth muscle in the walls of the vessel. It is estimated that between 22 and 64% of myocardial infarctions are silent MIs. In the case of acute MI, there's often sudden pain beneath the sternum, called angina pectoris, often radiating down the left arm in males, but not in female patients. Other common symptoms include dyspnea, palpitations, nausea and vomiting, diaphoresis, anxiety, and syncope. Many of the symptoms are shared with other medical conditions, including anxiety attacks and simple indigestion, so differential diagnosis is critical. An MI can be confirmed by examining the patient's ECG. Other diagnostic tests include echocardiography, CT, MRI. Common blood tests indicating an MI include elevated levels of creatine kinase, MB, and cardiac troponin, both of which are released by damaged cardiac muscle cells. MIs may induce dangerous heart rhythms and even cardiac arrest. Important risk factors for MI include coronary artery disease, age, smoking, high blood levels of LDL, low levels of HDL, hypertension, diabetes mellitus, obesity, lack of physical exercise, chronic kidney disease, excessive alcohol consumption, and the use of illegal drugs. Diseases of the electrical conduction system, or arrhythmia. The heart's natural pacemaker, the sinoatrial or SA node, initiates an electrical impulse 60 to 90 times per minute in a resting adult. This impulse travels through the heart's conduction system in order to ensure a smooth, coordinated pumping action. This electrical activity can be detected and recorded through the skin using an electrocardiograph. Arrhythmias may occur when the SA node fails to initiate an impulse or when the conduction system fails to transmit that pulse through the heart. In the event that the electrical activity of the heart is severely disrupted, cessation of electrical activity or fibrillation may occur. In fibrillation, the heart beats in a wild, uncontrolled manner, which prevents it from being able to pump effectively. Atrial fibrillation is a serious condition, but as long as the ventricles continue to pump blood, the patient's life may not be in immediate danger. Ventricular fibrillation is a medical emergency that requires life support because the ventricles are not effectively pumping blood. Left untreated, ventricular fibrillation may lead to brain death. The most common treatment is defibrillation, which uses special paddles to apply a charge to the heart from an external electrical source in an attempt to establish a normal sinus rhythm. A defibrillator effectively stops the heart so that the SA node can trigger a normal conduction cycle. External automated defibrillators, or EADs, are being placed in areas frequented by large numbers of people, such as schools, restaurants, and airports. These devices contain simple and direct verbal instructions that can be followed by non-medical personnel in an attempt to save a life. Abnormal heart rates. Bradycardia is a condition in which resting adult heart rate drops below 60 beats per minute. A client exhibiting symptoms such as weakness, fatigue, dizziness, syncope, chest discomfort, palpitations, or respiratory distress may indicate that the heart is not providing sufficient oxygenated blood to the tissues. If the patient is not exhibiting symptoms, then bradycardia is not considered clinically significant. The term relative bradycardia may be used with a patient who has a heart rate in the normal range but is still suffering from these symptoms. Most patients remain asymptomatic as long as the heart rate remains above 50 beats per minute. Tachycardia is the condition in which the resting rate is above 100 beats per minute. Tachycardia is not normal in a resting patient and may be detected in pregnant women or individuals experiencing extreme stress. Some individuals may remain asymptomatic, but when present, symptoms may include dizziness, shortness of breath, rapid pulse, heart palpitations, chest pain, or syncope. Treatment depends on the underlying cause but may include medications, implantable cardioverter defibrillators, ablation, or surgery. Heart block. A heart block refers to an interruption in the normal conduction pathway. Heart blocks are generally named after the part of the conduction system that is causing the problem. For example, bundle branch blocks occur within either the left or right atrioventricular bundle branches. AV blocks are often described by degrees. A first degree or partial block indicates a delay in conduction between the SA and AV nodes. A second degree or incomplete block occurs when some impulses from the SA node reach the AV node and continue, while others do not. In the third degree or complete block, there is no correlation between atrial activity and ventricular activity. This means that none of the impulses generated by the SA node get transmitted to the rest of the heart, and the AV node must take over as the primary pacemaker. Initiating contractions at 40 to 60 beats per minute, which is adequate to maintain consciousness. In order to speed up the heart rate and restore full sinus rhythm, a cardiologist can implant an artificial pacemaker, which delivers electrical impulses to the heart muscle to ensure that the heart continues to contract and pump blood effectively. These artificial pacemakers are programmable by the cardiologist and can either provide stimulation temporarily upon demand or on a continuous basis. Some devices also contain built-in defibrillators.